I'm asking now Janko from the University Hospital in Erlangen to come to the front.
Yeah, hello everybody, my name is Janko. I'm working for SEO in Erlangen and I'm happy to present our work here. Cancer therapy is routinely done by operation, irradiation or chemotherapy. Chemotherapy has a lot of severe side effects because of the unspecific leakage of the chemotherapeutic agent in the healthy tissue. We want to overcome this problem by magnetic drug targeting. For that, super paramagnetic iron oxide nanoparticles, we call them short spion, are synthesized and they are loaded with a biocompatible layer. Then these nanoparticle complexes are loaded with chemotherapeutics, here in our case mitoxantrone or cisplatin, and these nanoparticles are applied in the tumor-supplying vascular system and are enriched in the tumor region. With that, we can enhance the concentration of the chemotherapy in the tumor and preserve the rest of the body from the cytotoxic drug. Of course, we have to analyze our particles very carefully for their toxicological issues, and for that we use multi-parameter flow cytometry. Here exemplarily shown for Jurkat cells which have been treated with cisplatin, and here are the control cells. With this measurement method we can analyze in parallel the proliferation of the cells, the morphology of the cells, mitochondrial membrane potential, phosphodieldserine exposure and plasma membrane integrity to draw a comprehensive picture of the induced cell death pattern by our particles. Exemplarily I will show you now the results of the annexine PI staining as a marker for apoptosis and necrosis. As you can see here, fluid cisplatin induces in a time-dependent manner apoptosis and secondary necrosis. Our particles loaded with cisplatin also induces apoptosis and necrosis, whereas the unloaded control particles do not induce any cell death at all. Here you can see the transmission microscopy of these cells 30 hours after treatment. And when you have a closer look at these two conditions, you see that the particles which are coated with cisplatin have a slower induction of cell death, which is an indicator that the cisplatin has to be released from the particles before it can act as cytotoxic drug. We have also very promising in vivo data. This is the hind leg of a rabbit which has a tumor. Yeah, the tumor is very big, you can see it here. And we treated this animal with magnetic drug targeting using nanoparticles which are covered with mitoxantrone, and 11 weeks after the treatment we get a completely remission. We could observe this effect in 1/4 of our treated animals. This was a very big success for us, and of course our future aim is to reach the translation from bench to bedside. For that we have a very interdisciplinary team of physicians, biologists, chemists, pharmacists, and so we can offer the complete cycle from nanoparticle synthesis over nanoparticle characterization, nanotoxicology, which is my part, to the in vivo studies. Finally, of course, it would be great if we could reach clinical trials. A big advantage of our laboratory is that we are in close collaboration with the pharmacy department of the university hospital, so we can produce our particles under GMP condition, which is a prerequisite for application in the future. I want to thank our sponsors, I want to thank you for your attention, and I'm inviting you to visit me at my poster, number 72.